Hi there, this is David Nguyen, CEO of Brain Scanology, and in this presentation I will discuss how Shape Genie can precisely quantify cytological features of PAP smears in ways that traditional metrics cannot. And when I say traditional metrics, I mean area, perimeter, and color intensity. So the PAP smear is a routine diagnostic test to determine if a woman is at risk of having cervical cancer or has cervical cancer. By swabbing the tissue and viewing it under a microscope, pathologists can see whether the cells are normal in terms of their shape of their nuclei and their cell edges, or whether or not they're cancerous. But pathologists can also see whether the cells are not completely normal but not yet concerning regarding cancer, or if they have progressed to a stage suggesting that they are at high risk of getting cancer. In this presentation, we will measure the shape of the cell edges and the nuclear edges to show that Shape Genie can quantify these shapes in ways that the human eye cannot see, nor can traditional metrics. But first, let's talk about how the LCPC transform within Shape Genie works. In step one, you have the outline of the object of interest. And what Shape Genie does is it finds the smallest bounding box or rectangle that touches all four sides of your object. The center of that rectangle will become the center of a radial grid of 71 lines. Shape Genie then finds the intersection of every line and the edge of your shape as shown in step 3. And now it can calculate the distance of every intersection to the red dot, which is the origin. Now this object only has one edge. But if an object has multiple edges inside or outside of it, then all intersections on the same line will be added together into one number, such that Shape Genie turns the data in step 3 into step 4, and then it applies the fast Fourier transform to the data in step 4 to derive what's called a frequency plot. And this frequency plot is a multidimensional representation of the shape that you began with. Multidimensional data is like the day, month, and year of your birthday. It's a multidimensional representation of your age, and you can calculate your age as a scalar value, that is the number of years that you've been alive. You can calculate that from your birth date. Your birth date contains much more information than just your age. Similar to this analogy of your birth date versus your age, you can then calculate a scalar value, like your age, one number to represent the shape you began with, by creating an index. A simple index could be to sum all the bins together into one number, or to derive a ratio, that is to divide the value of one bin by the value of another bin. In this way, that simple scalar value represents the shape that you began with. For this project, when we measured the cell shape and the nucleus shape at the same time, what we did was we found the bounding box of the outer shape, that is the edge of the cell. The center of that bounding box then became the origin of the radial grid system. So in this project, the origin of the radial grid is not at the center of the nucleus, but at the center of the bounding box that surrounds the cell. In scanology, we measure something called pure shape, which is very special to our software called Shape Genie. So if you measure objects at the original scale, you cannot separate the effect of size from the effect of shape. But Shape Genie allows us to resize these two objects such that they here have the same height. And when we resize them, we constrain what's called the aspect ratio, so the shape doesn't skew. And what we compare then is their shape apart from their size. We call this pure shape. And this is something only Shape Genie can do. To begin, we wanted to show that we can clearly find differences between the easy cases, that is normal cells that look like this, versus the high-grade lesion cells that are indicative of getting cervical cancer. Here are the first 10 bins of frequency plots for normal cells. Here we measured both the nucleus and the cell together. And then here are the in-between lesions, and here are the high lesion cells. The second row is similar in that we just removed the first bin so that you can appreciate the heights of all these smaller bins, that is bins 2 to 10. You can pause the video to examine these in detail, but I will move on to discuss a few indices that are interesting. So these are examples of cells in the normal category, in this low grade category, and also in the high grade category. As you can see in the upper right hand corner, the index called bin 1, when measuring both the nucleus and the cell at the same time, shows very clean differences between gray, the high grade lesions, versus the normal and low-grade lesions. And we're able to find a few other indices that were able to separate the normal cases from the low-grade lesions. So this is great, but it's not surprising because the area of the nuclei and the cells are quite obvious, such that even the traditional metric of dividing area of the nucleus by the area of the cytoplasm or the cell will also give you very clean numbers. So there's nothing new here. However, we just wanted to show that we can measure the obvious differences. What we're more interested in is what about discovering unknown subtypes of the precancerous stages? These are the stages that give pathologists a hard time. So there are several staging systems. One is the Bethesda system, then there's the old World Health Organization system, and then there is the CIN system. Notice here that the authors of this figure used a color gradient of dark pink representing cancer to light pink representing the in-between stages. They use a color gradient because they're trying to communicate that interpreting which stage a cell belongs to can actually be very subjective and difficult. Thus, the goal of this presentation is to show that ShapeGenie can quantify precise steps in these gradients and that it provides the potential to derive an objective and quantitative staging system that can discover unknown subtypes in a way that unifies all three systems into one objective and refined system. So this figure in the paper from Al-Rajal et al. Gives examples of how these in-between stages, called atrophic cells, parabasal cells, and metaplastic cells, can mimic the high-grade lesions and be difficult for pathologists to identify. Working off of this figure, we will show that ShapeGenie can provide very clean and clear data, identifying the differences of each of these three categories. So here are examples of how we outline the edge of the cytoplasm, the edge of the nuclei, and these are the cells in which we could reliably identify the edges of both at the same time. And these are the cells that we will analyze in the coming slides. So these are the first 10 frequency bins for the 4 categories that we compared. You can pause the video to explore these graphs if you want, but I will move on to talk about the indices that we found to be interesting. The first index we'll talk about is dividing bin 5 over bin 2. And here we can see that this index separates the atrophic category from all the others very well, atrophic here being blue. And this index also does a good job of separating the HSIL lesions from the parabasal and metaplastic lesions, as seen in this purple box. Next is an index that is just a value of bin 1. This index does a great job of separating the parabasal from metaplastic category, as seen in orange and gray. It also does a great job of separating the HSIL category from the parabasal and metaplastic categories, as seen in the purple box. And it also does a great job of separating the atrophic cells, which are in blue, versus the HSIL cell, which are in yellow. Lastly, bin 8 does a decent job of separating the parabasal from metaplastic category, as seen in the orange and gray, but also does a great job at separating the metaplastic versus other categories. And by others here, I mean parabasal and HSIL. So I'd like to remind you that our goal is to show that ShapeGenie can produce clear data separating these in-between categories that can be very difficult for a pathologist to objectively identify when examining these cells under a microscope. ShapeGenie can provide clean data such that 1, or we can identify unknown substages, and 2, we can develop automated machine learning models that will analyze PAP smear images to help pathologists speed up the process of diagnosis. Furthermore, once we identify substages or subgroups, that will help us develop and test improved therapies. Now, I want to point out the question, what about shape indices that come from at-scale images? Because in the previous data, we measured peer shape, which is scaleless because we rescaled everything. We could not measure the at-scale shapes in these images because we did not know if these images were taken at the same scale. However, based on the visual differences evident to the naked eye, at-scale measurements will likely provide additional indices to discover new substages and improve the machine learning models. So let me summarize the main points. We have shown that these shape indices and others can help discover unknown subtypes within this continuum, and that these numbers can help us create machine learning models to classify each cell into one of these categories. This then allows us to calculate the percent enrichment of each of these categories for a patient, which allows us to correlate the percent enrichment from step 2 with each of the stages of progression. Precise quantitative gradients means that we can use dimension reduction techniques to potentially identify unknown subtypes or substages. In other words, we have the potential to develop objective and precise staging systems that can unify the existing staging systems that can be highly subjective. Lastly, I just want to point out that nuclear features are also useful in building classification models or discovering unknown subtypes. It is well documented that the texture of the chromatin in the nucleus changes dramatically as cells progress from the normal stages to the high-grade lesions. I just want to point out that chromatin texture, as we've extracted in these two examples, the top is a low-grade cell, the bottom is a high-grade cell, that these textures can be measured in Shape Genie using the parallel grid system. In this case, we'll be deriving a shape index that can be interpreted as a value representing the texture of the chromatin or the degree of folding of the chromatin. Adding nuclear morphology as a feature will increase the accuracy of the machine learning models that are based on the outer edge of the nucleus and outer edge of the cell, as shown earlier in this presentation. Nuclear morphology will likely help identify unknown subtypes of disease or unknown subgroups that respond differently to therapies. This is the end of our presentation. We hope that Shape Genie helps you find amazing things in your data.